Hello everyone, my name is Dr. Rachel and today I'm going to do a short video on the differences in the symptoms between the common cold and COVID-19. Now the reason I'm doing this video is I'm really concerned about the amount of misinformation on the internet and also on social media and the media with regards to viruses. And I like to help people understand complex health information, and that's why I'm called a healthcare navigator these days. But originally in my training, more than a decade of my life I spent studying viruses and how they cause disease. And then my first job was working on some products that are given when you get bitten by a snake or a spider, and they're actually made by making these products in animals which could have viruses. So my job was, I was employed by the company on behalf of the Australian government to make sure that the products are safe for Australians. So I can tell you that those products, 4 of the products that are made in different animals, if you get given the snake or anti-venom products, you will not get a virus from those products, thanks to my work back a couple of decades ago. After that, I went to an antiviral discovery lab, and I was actually for 5 years running a respiratory virus antiviral discovery lab. And so we used to grow live human influenza virus and other viruses like corona, as well as the common cold virus. So I know how to grow those viruses and I know how to kill those viruses. So what I'm going to do now is just take you through the symptoms that you'd expect with a common cold, and also the symptoms that you can get with COVID-19, and why it's different why it's important to understand the differences in these symptoms, and so that you can protect yourself, you can minimize infection in your family at home, and also protect people in the public, and also know their symptoms as well when you see them. So there's really 2 symptoms that differentiate the common cold and COVID. So the common cold, I'll just explain the name because there's a lot of, there's a wives' tale that if you go out in the cold you get a cold. Which is incorrect. So the cold virus is actually, the name of the virus is called rhinovirus, which means nose. And that virus grows in the nose at a lower temperature than the rest of the body. It's actually 3 degrees lower than the rest of the body, and that's why it's called the cold virus. So we used to have the incubator in the lab turned down to grow the cold virus because it was growing at a lower temperature. So a cold virus, or the common cold, the main symptom that you can use to tell it apart from COVID or anything else is a runny nose and sneezing. You also might get a headache, itchy throat or whatever, but the main symptom is sneezing. Now, if you sneeze unprotected, that can go up to 8 meters. It doesn't always go that far, but that's a really long way that you are sneezing out live virus. So one of the things that we need to teach people, including adults and children, is when they are sneezing to cover their nose with a tissue if you can find one, or sneeze into the elbow. And basically don't sneeze on other people so that you don't spread the virus around. Now, if you do sneeze into your hand, then you've got virus on your hand. So what you need to do then is wash your hands properly. And I'll put the link to the WHO video, which is about 1.5 minutes, which shows you how to do correct hand washing, which, you know, ideally is for 60 seconds, no less than 30. So we're aiming for 60 seconds for correct hand washing. And correct hand washing kills all takes away all viruses, bacteria, mold, everything is taken away. Now, if you have sneezing symptoms and headache and so on of a cold, you won't feel great for a couple of days, but please don't go to the GP because there's no treatments for the common cold and you're just clogging up the healthcare system. So we've already seen bad behaviour due to people being scared with buying things and you know, thinking about themselves. When it comes to healthcare, we really need to what's called triage or prioritize people that are sick. So there's people with cancer and other very serious diseases that need access to doctors. And, you know, if you've just got a cold, please don't go to the GP and ask for antibiotics and other things, because one, they don't work and there is no treatment for the common cold. So you're just going to wait it out at home. So stay at home, keep up the fluids and, you know, rest. So let's then talk about the COVID virus symptoms. So the difference is, and this is the same for influenza, the virus actually grows in the lungs. So because the virus grows in the lungs, it is spread by coughing out the virus. When you cough out the virus, if you cough it onto your hands, it's then on your hands. You cough it onto other things, handles or whatever, it's on other things. So we need to protect our coughing. So we need to cough into our elbow, cover our mouth. And then if we do cough, we need to wash our hands. Now, if we have symptoms of coughing, as well as increased temperature, and that's why they use the thermometers on the head that you see on TV, plus mouth thermometers to check temperature. So you could be sweaty or this elevated temperature in your bed. You can often tell because you'll have wet sheets, but essentially if you're sweaty and you've got aches and you're coughing, this indicates you could potentially have COVID. So if that is the case, ring the COVID hotline and ring ahead to tell your GP that you think you might have COVID, to check that you can get the test kit or the test done. Book that in before you just go in there potentially with COVID. And stay at home and self-isolate. So you need to use good hand washing at home, and also cover your mouth, cough into your elbow, and stay rested in bed ideally. Or, you know, I suppose a lot of people are watching TV these days at the moment because there's not much else to do, but essentially stay at home to minimize the spread of the virus. Because what we're trying to do, because there's no current treatment for COVID, we're trying to stop people getting very, very sick, and we don't want it to spread to everyone. So the main difference is then coughing versus sneezing, in summary. So I hope that really clears up some confusion for you, and the symptoms are really easy for you to pick apart. So you've got the sneezing, runny nose, common cold, and you might sound a bit stuffed up, versus coughing and fever. So thanks for listening, and I'll do some more videos for you soon, but hopefully that's helped you make sense of the symptoms, the differences between the common cold and COVID. Thanks a lot.